All right, we are live. We are live. Okay. Let me see, let's wait for people to join here. Let's see if anyone's joining. Good evening, Facebook family. Waiting. Okay. Say hello. I see someone just joined. Say hello. Hello, hello. There's one person watching. Hold on for a few minutes and see if anyone joins us this evening. Okay.
Right.
Okay, there's someone else. Sean, hi. Thank you for joining us this evening. Okay. What's going on in Texas, Sean? I understand you're getting ready for the rodeo. When does that start? He's not talking to me.
Okay.
He's gone. Let's see if anybody shows up here.
Help Miss Carolyn get on.
Uh-huh. Okay. Just holding tight here for a second, and then we'll start once get a few more guests. All right. Hello, hello. I see someone's joining. Say hello. All right. We got 3 people. Woohoo! Okay. Got a good topic tonight, so hopefully more people will join. Let's see who else. Hi, Miss Carolyn. Hi, Dr. Jaquel. Thank you guys for joining this evening. All right, so we have some guests, so let's get started. All right, so today is a special edition of Thursday Tips with Dr. Janine. We're going to be talking about the skinny on mommy weight. So we're going to chat about pre-pregnancy, pregnancy, and after pregnancy weight. And I have a special guest here with me today. All right. So I'm just going to introduce myself, and then I'm going to introduce our special guest. And please be interactive. If you have any questions, drop it in the comments, and we can answer that today because our special guest is an expert. So if you have any questions, just drop it in and we can try to answer it tonight. All right. So I'm Dr. Janine. I'm board certified family doctor and also weight loss specialist. I help women feel better about themselves, get healthy, and get their sexy back by providing a comprehensive medical weight loss program. I'm also the owner of Lifestyle Changes, which is a virtual medical practice here in Pennsylvania. So tonight, we're going to talk about the skinny on mommy weight. We have a special guest and going to introduce her. This is Dr. Rwanda Campbell. She is located in Minnesota. As you can see her background there, it's a lot of snow happening. And, you know, behind her head there, she also takes care of bees. I'm sure she can tell you a little bit more about that. So she sends me all the honey, so. and I love it. So I'm just going to introduce her. This is Dr. Rwanda Campbell. She's a board certified OB-GYN. She is Ivy League educated. She went to Dartmouth for undergrad and for med school. All right. And she's also, I already mentioned she's an OB-GYN, but she's an international renowned OB-GYN. Yes, she is. She has taken care of patients, women all over the world. So she knows all about the ins and outs of OB-GYN. And she's also a veteran of the military. She's a wife of 30 years, and she has 2 handsome, awesome sons, all right? And she loves to travel and loves to garden. And I'm gonna let her take the stage for now. I'm gonna ask a few questions, and feel free to drop your questions in the comments as well. This is gonna be exciting. I'm excited, all right? So we're gonna chat about pre-pregnancy, pregnancy, and after pregnancy weight, and I have the expert here. So when you get patients coming into you in the office, what type of advice do you give them about their weight prior to pregnancy?
I'll tell women, I say it's very important for them. I consider their body to be the bakery or the nest for this baby. And so I said to optimize the environment for the baby, you have to optimize your health. So if a woman comes into me and she may have some challenges with weight, I said, we need to optimize your weight and optimize your health. So we talk about the importance of eating correctly, appropriate weight loss, and having an exercise program. And just a way for her to prepare, feel very, very good about herself, even before she even thinks about even becoming pregnant.
Okay, awesome. Okay, and then so when this lady comes in and she's like, I'm pregnant, Dr. Campbell, how much weight gain do you recommend during the pregnancy, if they're of normal weight versus if they're obese? What are your recommendations?
So I think probably the most important thing we actually do a pretty comprehensive taking a history of their medical problems as well as their surgical history. Because a lot of those things, regardless of what their weight is, those also may have effects on the pregnancy. Mm-hmm. So, but when it comes down to the issue essentially with their weight, usually most women I ask them, say, do you feel like you're overweight, underweight, or is this your usual weight? And yes, there are some guidelines out there to talk about, what your BMI is, your basal metabolic index, as opposed to you being obese or not. But on average, talk about your usual weight woman, anywhere from 20 to 25 pounds. The heavier women, I say maybe 10 or 15 pounds, at the most. But a lot of it really depends on how their weight can affect some medical problems they have, whether it's diabetes or high blood pressure, and how that may affect themselves pregnant, as well as may affect the baby.
Mm-hmm. Okay, that's great. So do you go over like the weight loss, weight gain complications, like if they go over a certain pound or something like that? What type of complications can happen if these women aren't mindful of weight gain?
So the biggest challenge with mindful weight gain is that if I have a patient that comes in, say is of usual weight, and then all of a sudden she's gaining weight, because sometimes women get this for thought, like I'm eating for 2. And so I always have to tell them, like, don't do 2 scoops of things, eating for 2. Right. I say it's so important at this time that you really watch what you're eating, making sure you have, the protein and your fruits and vegetables, like the clean foods, because you want to have that clean weight gain, as opposed to, let's suppose, I don't know, the challenge is, so usually like in the beginning of the pregnancy, most women have like sometimes morning sickness, where they kind of nausea, vomiting, really can't keep food down.
Right.
So then pregnancy, at that point, I tell them, I said, you know what, I just need you to eat whatever it is you need to eat just to keep yourself hydrated. So usually maybe those first 12, 13 weeks, they may not be able to eat, the appropriate amounts, the appropriate types of foods. I'm just trying to get them to stay hydrated. So I don't necessarily get, really push it necessarily, like make sure you're eating this in the first part of the pregnancy. Once they're feeling better, then I say, okay, game on now.
Right.
We definitely have to, we definitely have to look and see what you're eating, how much you're eating, and what you're eating as far as everything.
Okay. Okay. Good. And then, so like for complications, do you see like a lot of gestational diabetes or, preeclampsia type stuff or?
Yeah.
Yeah.
So that's a great question, Dr. Janine. So
Yeah.
really what happens is that, so if a woman usually comes to me and she is already overweight, that's, honestly in our culture, that's my usual challenge. I mean, have young in their 20s who have, who are 200 pounds, 250 pounds in their,
yeah.
And so I really have to say to them, okay, so this is our challenge. You're overweight. And what this may mean, you may increase risk of getting diabetes when you're pregnant, which means that because already the body just kind of sets itself up to where the placenta does not make it optimal for the body to manage carbohydrates or manage sugars. So the placenta unfortunately it's the best thing for the baby as far as supplying the baby,
right?
Like complications for women and stuff. And so that's why some women can be a diabetic, meaning that they can't really manage the sugars in their body in their pregnancy, but may not be that way when they're not pregnant because the placenta is not there. So those patients that are at risk, if they have diabetes when they're pregnant, that now their baby is inside and is seeing all these high sugar levels and stuff. And so that can cause the baby to really grow and really get really big, which unfortunately can cause difficulty at times of delivery. Or sometimes those babies, because they see those high sugars, when they're born, they still think they're inside of mommy and they end up having some problems at the beginning when they're born as well. So it's diabetes, and also at risk for high blood pressure problems as well. We call it maybe, but the big issue is just high blood pressure. And again, what can that do? That can cause those babies not to grow as well. Can cause problems for mom, which can cause babies when they're inside the uterus because they're not growing. And sometimes they have to be born early, or when they do come into labor, we end up having issues where they need to get this baby out quickly.
Yeah.
So that's really can be an issue for moms, immediate during that time with diabetes. Also, but if a mom either has high blood pressure during pregnancy or high blood diabetes during pregnancy, that means down the road from them, they're at risk of getting those same medical problems when they're not pregnant. So we really just try to take care of the woman when she's pregnant, and also her when she comes back. I was like, gosh, how can we get you healthier again as well?
Yes. Oh, that's great. That's awesome. Okay, so for these women that are gaining more than usual, do you recommend any type of exercises, or for those that are already exercising prior to pregnancy and then get pregnant, do you put any restrictions on exercising, or how do you deal with like exercising during pregnancy?
Okay. So again, when the patient comes in for her first visit, again, we do a very comprehensive history of physical and also about her social habits. And so, and patients ask, well, Dr. Campbell, I think I'm gonna start exercising now that I'm pregnant. Like, okay.
And they never exercised before.
So then I tell those women, I say, please don't start Beachbody. That's one thing we will not start Beachbody at this
right
stage. But I do say, so I ask them more important, what do you usually do? So I have one group of women who come into me and say, you know what, I run, I'm a runner, I'm a swimmer. And I say, great, you can still continue to do that. And a lot of that is long, but the difference is that when they get tired, like if there's no like, oh gosh, let me just push through one more block or one more mile, then you have to stop. So then you have to gauge and just listen to their body at that point. So my high intensity exercise women, they can continue to run and do what they usually do because their body's already conditioned.
So through full term pregnancy?
I mean, yes, as long as they can tolerate it, if they can tolerate it. My runners will say, gosh, I can't run as far because now I got this big belly, and get tired quicker. Okay, then they stop. They'll stop with their run as far as that goes, everything. And so it's just pretty much what they're usually doing. Now, my women who say, Dr. Campbell, I've never exercised. What am I gonna do now? then we start more of the walking program, or swimming, just some type of exercise.
Right.
Now we recommend, like we do for all, 30, at least 30 minutes of moderate degree of exercise for at least 5 days a week. That's what we recommend. So depending on but depending on where a woman is in her life, if she can do that or not. So we talk about brisk walking, swimming, or like, yoga, Pilates, those types of things.
Okay.
What I don't recommend though would be like hot Pilates, or hot yoga.
You
I
do
would
not recommend that.
do not recommend skydiving. You know what I mean?
Right.
Right. I mean, I do not recommend, for my Texas people, riding the electric bull,
Got it. Yeah.
And the big thing, so that's usually, but it's just really, it's just the beauty of having a relationship with your obstetrician gynecologist. You all can talk about it.
Right.
And this is what I do. What do you think works best for me? Everything. So.
Okay. All right. Awesome. All right. And then when should a mom after pregnancy or postpartum start exercising? So
Yeah, I think, I tell women it depends on how you feel. Usually what kind of the first thing they enjoy doing is walking that baby, walking that beautiful baby of babies with the stroller. So I said, when can I start doing that? Whenever you want to, and everything. Right. Usually how it starts, with them, taking walks with the baby and getting outside with the baby. Then my patients who say, so the runners, again, it's about, when they feel like they can do it. Now, of course, if a patient has a vaginal delivery.
Right. There's a difference there.
Difference as opposed to someone who has to have a surgery for her delivery.
Right.
So patients of vaginal delivery, they can exercise when they're ready. When they feel like they're up to it. I just say it's probably going to be probably going to be a little bit deconditioned, from having the baby. Right. But it's kind of being your usual work back up. You can do that. Who've had a cesarean delivery, who had the surgery, those women, as far as abdominal exercises, they're not about 6 to 8 weeks, so even running at that point, but they certainly can walk around and push their baby around and everything. And so for a lot of women, that is what kind of the first part of the exercise of getting back into their usual thing is with their baby and everything, pushing around, or either walking them, with the carrier on and walking them too as well. And so that's great as well.
And it's probably good just getting out the house, good for the mental psyche and everything.
And sometimes too, she may feel like, again, I'll leave the baby at home and I'm going to go out and walk on my own as well. So, not to say they have to, their first exercise has to be with the baby per se. But also too, it's also sometimes that's nice to get out, walk around and collect your thoughts as well, So.
And then what about those ladies are like, I need to exercise. I need to get this body back, thinking about like the Kim Kardashians that, bounce back and,
No, I mean, if those women were exercising before pregnancy, then they probably can't get back to their usual routine after delivery. One of the two now those moms who choose to breastfeed. So those moms are going to be more likely, eating a probably higher calorie count, so than women who are not breastfeeding.
Right.
And their whole energy may be different. And so that them getting back into exercise may also help them as well. So I think it's just it really comes up in individual.
Correct.
Been to having a relationship with your OB provider, where she's your midwife or your physician, and okay, this is what works for me, and we'll try it. Oftentimes, especially when I'm going back to the gym, I say, you go back to the gym and see what you can do. What I mean? Don't hurt yourself, because usually they'll have a trainer with them, a personal trainer,
right?
And see what you can do. Because there are a lot of health clubs now as well that have like a postpartum exercise program, where they have a whole fitness program, and some of them even started while you're pregnant. You can come at our facility here in Minnesota. Women can come and join the health club while they're pregnant, and they with a personal trainer, and they're doing exercises while she's pregnant. And after the baby, they have a workout plan when she comes back and everything. So it's we are really into promoting health women, because certainly healthy moms make healthy babies and healthy families, everything.
How about that, right? Just trickles down. It's all good.
It does. And so it's very important for the mom to take care of herself. That's why women, even when they come to me when they're not pregnant, say, I need you to be healthy for you. Right. So therefore, when that baby is inside of you, you're healthier, and then in turn that baby is born, everything.
Correct. Exactly. Exactly. Yeah. So like for your C-section, ladies, do you tell them to wait like 6 weeks or something to exercise or any?
So again, depends on it depends on what she did beforehand. So if my marathon runner ends up having a cesarean, those women are pretty healthy. So in
Okay.
her case, she's probably, I'm not going to have her to do her crunches, therefore, putting stress on her incision. But if
Yeah.
she start walking brisker after, kind of after delivery, that
Wow.
is fine.
Okay.
I mean, but again, us talking to each other and
Mhm.
her getting into her body so that she, they really can't injure anything per se. It's just that she'll feel like, oh my gosh, she'll come like, I really worked out. And then she'll be sore and achy. You know what I mean? So they're not going to bust open their incision or anything like that. It's the issue of them just feeling achy, if they've done too much too soon and everything.
Right. Right. Yeah. Yeah. And then, bonus question here. So, some people use sex as exercise sometimes, I guess. So when do you recommend to for ladies after pregnancy to start with sexual intercourse again?
So here we go. Here's
Yes.
it's a couples thing, it's a relationship thing. So
Yes.
my thing usually is, this right. Now tampons and no sex, at least for 6 weeks. I said, but anything
Okay.
go on externally, okay?
Okay.
Wherever they can do externally that gives them orgasmic experience, that
Uh-huh.
is, you know what I mean? So
Okay.
when we say no intercourse, I mean we mean really nothing in the vagina for
Right.
6. But
Mhm.
certainly couples are able to be intimate, to be cuddle, to have
Mhm.
orgasms, everything outside of without actually having vaginal penetration.
Right.
So again, it becomes a couples thing,
Mhm.
and it depends on what type of activity they do, and so people always joke and say, well, it's the kid. No, it's not necessarily always the kid that's, that's some,
Interfering?
from occurring. But
Yeah.
couples, I mean, it's a special time for couples as well as families, and a special time for couples to be intimate. But I just say just nothing in the vagina for that amount of time, at least for 6 to 8.
Okay.
And I say when you restart it,
Mhm.
it's almost kind of like riding a bike. I mean, you have to kind of be slow and kind of like, oh, okay, where are we?
Yeah.
Again, not gonna break anything. Just maybe sore. If anything. So
Mhm.
yeah.
Okay. Great, great, great. So there you have it, ladies and gentlemen. The OB-GYN expert, the international renowned OB-GYN expert. And the best thing is she's my sister in love. So yeah, I'm married to her brother. So that's great. So anyways, let me see if there's any questions here for you, Dr. Campbell. Okay.
Okay.
All right. Okay, so Miss Carolyn says, do you have moms who say, I don't want to go through regular childbirth and can have a C-section?
So that's the whole issue with the maternal request for cesarean delivery, which has become somewhat popular in our society now.
Mhm.
And women do it for different reasons. Some because they have the fear of having a baby vaginally.
Mm.
Some just say, well, everyone in my family has had C-section. I want to have one as well. So
Mm.
it goes back to you having a relationship with your obstetrician gynecologist about what your concerns are and why you want to do that. And so I've had such situations where I've had patients where at the beginning, when they first come in their pregnancy, oh my goodness, and for certain reasons why they want to have a cesarean. So again, it really becomes about risk benefit, about counseling women, and then and seeing what their decision is going to do. So in this day and age, I cannot make a woman have a trial of labor for vaginal delivery. I just can't. But if she comes to me, we've had a discussion and she understands what the risk, what the good things about having a vaginal delivery versus not the good things, or C-section, she really wants to do that, then we can agree to do that. But not necessarily around with the woman who's coming in labor and because she's because the labor has gone on for too long or she's in pain, God, just cut it out. That we have a discussion. We figure out how can we get you comfortable.
Yeah.
This is the process of labor. and so that, and so that, and usually at that stage, you can usually kind of deviate and say this, oh, we can just get you comfortable. Okay, we can just get you, get you an epidural or whatever. Oh, I didn't know that. And so, so again, it really comes down to having a relationship with your obstetrician, and it's for you all having a discussion of what this means and what this doesn't mean as far as that goes.
Okay, good. Thank you. All right. So I think that was the only question that I saw that came through. Thank you so much for coming on and sharing your expertise, about pregnancy and after pregnancy weight, and how to just stay healthy. That's all it comes down to. Stay healthy, eat well, exercise if you can, and definitely have that conversation with your doctor.
Absolutely. So important too.
Yes, yes. Thank you so much, Dr. Campbell, for coming on this evening and being a part of Thursday Tips with Dr. Janine. So thank you all for joining. If you catch this later, just put in the comment #replay. And if you have any questions as well, put that in the comment as well. So we're going to get out of here. Do you have anything else, Dr. Campbell, you want to share before we get out?
I mean, it's just an honor to be on the program. And, as we were talking about before, just one thing I probably did not hit on was that but also if a woman is overweight, also can affect her delivery. And so, because if I have, women who are over 200 pounds, sometimes that means that an increased risk of their labor not working. So then, it puts them in increased risk of maybe of having to have a cesarean delivery, which is a surge, is a whole other issue to put another risk as far as that goes.
Right.
So those women, so it can affect the mom during the pregnancy, can affect the baby, but also it can also kind of affect the type of delivery that she may have and everything. So we have this, it can be a challenge where you may have to deliver at another type of hospital versus your favorite hospital, your smaller hospital, because women who are heavier that are laboring and delivering, they need to be at a place that if anything doesn't go right, that they can be taken care of appropriately as well and everything.
Correct. That's correct. So if you don't want any complications,
right,
have a healthy weight. That's the key here. Have a healthy weight, and then you don't have to worry about any of those things. Yeah.
Okay. We all should be members of as being careful about lifestyle changes. So
love that plug. Thank you. Yes. So thank you so much again, Dr. Campbell. So we're going to get out of here. Okay. I'm Dr. Janine. Your board certified family doctor and weight loss specialist. I help women get healthy, feel better about themselves, get their sexy back by providing a comprehensive medical weight loss program. Also, I'm the owner of Lifestyle Changes, which is a virtual medical practice here in Pennsylvania. If you have any questions or you need my help or assistance in getting that sexy back, you can follow me on all social platforms at Dr. Janine Darby, or you can look at my website, which is www.lifestylechanges with an S, LLC.com. All right. Thank you for all joining. We're out of here. Thank you, Dr. Campbell. Okay. Stay nice and warm in Minnesota.
Always do.
All righty. Take care. All right. Okay. Bye-bye.